Harris, CEO and Medical Director of HFit, and we're planning to discuss COVID-19 and the BA2 and the subvariants, mass tests, vaccinations, and we're going to get hopefully into the long haul. That's what the plan is here. I hope all this works out. And outside here in western suburbs in Batavia, it's 49.8. And I assume that's what it is in downtown Aurora, which we're seeing here on this background. So it's 49.8 right now. So that's, and drizzle out there. So that's not the greatest. But it's getting warmer. So here's the statistics from the state of Illinois right now on what's happening with COVID. This is what's happening with COVID right now in the state of Illinois. And we can see that we've had a boost of almost 4,000 cases in one day. It went up 4,000 from the day before. And that's about a 50% jump. It was like 2,400 the day before. So it's the cases, though, and the deaths, though, that's been pretty steady, though, and not jumped too much yet. We have 9 deaths recorded there. And we can see in Kane County that the number of cases went up 168. That's a little up, but we've been holding for a few days here at 0 deaths. So that's the good side of that, what's happening in Kane County and the state. So the numbers are going up, and we're looking forward to talking with Dr. Harris about these matters. But there's another thing out there is we'll have Dr. Harris here hopefully very soon. And another thing that's out there that we should talk about is our friends in Ukraine. Here's a scene of art. It shows foot washing of a mother with a baby Ukrainian, that Jesus cares for us and he cares for Ukraine. That's our prayer here. I'm going to bring up my special prayer thing here. We want us to pray for Ukraine in the days ahead. So I want you to really think about Ukraine, and we're hopefully going to have some guests. We're looking for a Friday guest on that. We have some next week, definitely, though, but want more guests. We had Wally on Monday here, and that was really good talk with Wally. And he updated us quite a bit about what's happening in Ukraine right now. So we'll see what happens here. We might have to have Dr. Harris come back another day. We've done this before. He gets busy. He just his schedule, sometimes he's overscheduled, I guess. So we're going to see. There's a lot of questions we want to ask him, and he says he's going to be with us in a few moments. I just got a note from him, so he'll be joining us just momentarily. So we're going to discuss, again, what's happening in the state of Illinois, and I'm going to put that, going to put this on again. This is where you get your vaccinations. And I just want you to think about that. Go out and sign up with the VNA to get a vaccination. And you can call them at the VNA, and you see the number there, or you can go online. I finished up my 4th shot the other day, about a week ago, a little over a week ago. So I have my 4th shot, and you're over 50, you can qualify for a fourth shot. And if you're immune compromising at any age, that you can get in on that fourth shot. So that's what we have here. And so we want you to do that, get that fourth shot. So we're going to have Dr. Harris here momentarily here. And we're going to get this back up here. He's going to join us soon, real soon. He says he's coming on board. So we'll have him momentarily here. And there's other ways to get these questions answered, but I think it's good to have Dr. Harris, who's had expertise on, he's just, this HFit thing that he has is across the country, and he does just a lot of things. I'm going to give you a little background on Dr. Harris here. Why don't we just do that while we wait? He's the founder of HFit Health, and it provides clinical and technical solutions to today's workplace health challenges. And he's an avid learner. And Dr. Harris holds an MD and an MBA degrees from Indiana University and an MPH from the University of Illinois at Chicago, and a completed fellowship in blood design. I guess that's what that. I'm reading that wrong. Yeah, and so he's the founder of HFit, and he's a speaker, and he's certified in occupational and environmental medicine, and he's advised a lot of America's largest companies and spoken on leading health conferences and other things along that line and with media. And he's been in recent months, I know he's been on News Nation, and he's been on CN, NBC, and Fox and other outlets. So he's been around talking about COVID in the workplace and just generally about COVID. And I got a friendship with him through my church. So we got knowing him about him. So that's how we got acquainted. So he should be joining me any moment, he says here. We'll just have to wait here. And we'll see when he comes here. He should be here any moment. So we're going to talk about the COVID variant, BA2, which is part of Omicron. And so we'll just be waiting here a few more moments. Hopefully he'll be here. And like I said, on my shot, I just received, well, I didn't receive much a little ache in the arm, but I did receive aches later. I got my shot on a Tuesday. That evening I was a little achy, but then I had a little chills while I was sleeping that night. And then in the morning on Wednesday, I started to feel achy, and by the midday I was having a fever, and it went up to, excuse me, about to 101. Took a little Tylenol, went to sleep that Wednesday night, and that was it. It just sort of alleviated, and it was gone. So that's a story there. Let's see. I'm just going to look at my phone here a moment, folks. See if there's something I'm supposed to do to. If Dr. Harris was saying anything else, he said it was going to be coming by soon here. Oh, he's on the road situation. So he's going to get to his home studio. So we'll just keep going here a few more. We'll keep going until he gets here. We don't want any problem for Dr. Harris, though. So, so I hope you can all join and just tell your friends to come online and join us. And we're just going to have a good session here with Dr. Harris when he comes by, and he's going to be with us momentarily. And we thank him for taking time out to do this with us. So, like I said, I had that momentarily little ache and a fever after the shot, the fourth shot, but that worked out real well. I did get my shot at the VNA in Aurora, and you can get your shots at other places, your doctor, some pharmacies, most pharmacies. So there's a lot of ways to get that fourth shot, but well, let's hope you got the third shot and your initial shots. So we got to keep that going, and we're going to touch base on some of these type of things with Dr. Harris. So just hold the line here. He'll be with us shortly, and oh, he's with us now. He's going to be with us momentarily. I see him in my queue. He's looking good, looking sharp. Okay, we'll bring him. I'm going to take down my Ukraine thing here, and we'll bring him up. You ready there, Dak? Okay, we'll bring him up. There he is. He's been traveling around. So I thank you that you could travel over for this little time, and we can talk, and we got to spread the word what we're talking about, because I think we got some important topics here.
Absolutely.
Important. They really do. And as we said before, Dr. Harris is with HFit, and he's the CEO of that organization and founder. And we appreciate him taking some time to be with us. And let's get right to the chase, as they say, or whatever. I guess that's the way to look at it. What's your thoughts on COVID right now and BA2, and just general thoughts on that? We can discuss more in depth here, but what's your thoughts there, brother?
Yeah, I mean, we're heading, the wrong direction. We've been flat for, several weeks, but now we're seeing uptick in multiple locations throughout the U.S., and that uptick is at a woefully underestimated number.
Oh, yes, right.
Yeah. So if we look to the Northeast, we're seeing numbers significantly increase. And we know the underreporting is as high as just a couple out of 100 positive cases get reported, like in Florida. So, we may be in for another, a dramatic increase across the board as a result of, not just BA2, but maybe even some of the new variants that are out there, like XE.
Oh, there's another one. Okay, you're always ahead of me. There's a new variant out there too, huh? There's another one.
You know it. I mean, there's been actually two more. One called Deltacron, which is kind of a blend of both Delta and Omicron. And yes, it can happen in terms of
it's a marriage here, huh?
Yeah, and then obviously with BA2 and now XE, which is even more contagious than BA2, which is already 1.5 times more contagious than the original Omicron or BA1.
As I would say, yikes. And then to fill in the story here, as you said, we don't know on these numbers as well as we used to somewhat, because a lot of people are doing tests at home or other ways. So we're not, some would say that could be off. I don't know. It's just an estimate. You could say 3 or 4 times more people might have COVID than the cases, right? Something like that, maybe.
Well, in some cases, perhaps even 15 times more cases than what's being reported because individuals are doing the home test. And one part of the argument is, should we be paying attention to the case rate at all? Right?
Right, right.
We know that the CDC has turned, and others have turned to looking at hospitalization rates um, to understand the severity of any new variable, right? And what that move does, in a positive way, is we don't have a potential overreaction, perhaps, as some have argued, to case rate increases, right? The
Right.
downside, however, is if we are hit, well, two parts of the downside. One part is we have a abysmal case fatality rate compared to our neighbors, right? In some cases, we've been 10 times higher than UK in terms of case fatality rate from COVID-19.
Oh, right, right. So if we don't get the cases precede the you know hospitalizations or deaths, and we got to watch. In other words, we don't have any way to really. It just sort of happens on us. Is that what you're saying? The
Well,
death.
that's the second argument. The first argument is that we just, if I can speak frankly, we just still aren't as good as our neighbors at keeping people alive that get COVID here in the U.S. And we have some predisposed risk factors. 40% of the deaths in the U.S. have been diabetics, right? And so we know that we in America have increased risk, and we're losing lives at a much higher rate. Again, 10 times so than the UK and then Germany as well, right? Even though they've had dramatically more cases recently in the last weeks than we have, our case fatality rate has been higher than theirs. So there's, obviously something to be said about how we should behave to protect those vulnerable and still the above normal loss of life. If we look at the epidemiology of the CDC, referring to what's called the PIC percentage, those are the percentages of deaths from pneumonia, influenza, and COVID-19. And we are still above our seasonal threshold for those types of deaths, which suggests we're not out of the woods yet. And there's other markers that we should be paying attention to that point towards potential for another spike, if you want to call it that, or surge. Perhaps still not as high as we saw with Omicron, the first Omicron, but we should still be concerned because of the impact that it's having in regards to loss of life.
Yeah, I reordered more tests. I haven't used this many, but I'm got a feeling I'm going to be using more. You can have a double dose of tests ordered, so I ordered another 4. I want to say, if you want to get tests, they're easy to do online. I mean, it's too easy. It's just put your name down and your address, and that's it. But and I don't have insurance to do it that way with Medicare, so that's the best way to get your free tests. But anyway, and you discussed that's necessarily not always reliable, right? These tests.
Well, yeah, I mean they are a great tool, right, for understanding if you are symptomatic with a positive test. Yeah, you probably most likely have COVID.
Yeah.
But if you've been exposed and you have a negative test, doesn't mean you don't have COVID. It decreases the likelihood that you do. But we know that the false negative rate is higher than perhaps some would like with these types of tests. So
Okay.
still using precaution. A good level of precaution is prudent. Obviously, mask wearing is becoming fleeting, and we'll see what happens with the federal appeals court in terms
Right.
of the judges basically stay of the mask mandate for airlines. So a lot of things going on, as you mentioned earlier.
Yeah, this mask thing is something else too. How we handle that, and I still wear my mask, my KN95 mask.
Mhm.
And I got my new batch, which I have. They're pretty good. The newer batch got the new ones you can get from the government, as you see there. You can get those free at a lot of pharmacies are offering them, but anyway, that's how you get them free.
Mhm.
And Anyway, those are pretty protective, right? They that's an N95. Hey, Kane, those are masks are pretty protective, right?
They are very effective means to protect oneself and others from COVID-19. So I'll be hopping on a flight tomorrow morning, 4.5 hour flight, and you best believe I'm going to be wearing
Oh,
my mask
okay.
regardless.
Well, you're
Yeah.
going to be testing out the new guidelines there,
Yes, I
right?
am. Yeah, so we'll see what it's like, but I'm certainly going to be wearing my mask,
I
as my
I,
travel
I
companions will be too.
I'm glad to hear that. I thought you would be, but I know you.
You bet.
Now,
You bet.
uh, we well briefly. I had my fourth shot, so I did get that. But of course, I did get my afterglow effect again. I got 101 fever for about 1 day or less,
Mm-hmm, mm-hmm.
and then it just dropped off, and everything's fine.
Good, good, good.
But we got to encourage people to get their first shot, second, and their boosters. So I guess I
Mhm.
don't know what they call. Oh, it's second and third, and then this is the booster, and instead of the other way around, the other was the booster. Now
Mhm.
you're supposed to have three shots. That's the what the protocol is now. At least have the three, and then get this.
Mhm.
Is that what the point? I
That you're right. Yep. To be current, 3 shots for the majority of folk, and then if you're 50 and older, 4 shots is what keeps you current in terms of recommendations right now.
Yeah, yeah, and maybe we'll see how long this lasts till the fall, maybe,
Mhm.
maybe.
Indeed.
Well, we were going to discuss. I wanted to discuss a topic that you had mentioned, and I think we've discussed here a little about tests and masks, but let's get to the thing that people sometimes forget about, and you've been thinking on this, the long haul effects of COVID. So you want to just discuss how that looks to you, the long haul?
Sure. I mean, we know that long haul or long COVID, post acute COVID, all go by the different names, but all the same thing, referring to here in the U.S. Having symptoms from COVID 4 weeks after recovery from your acute infection. Right. If we look across the pond in other nations, that definition is having symptoms 3 months after a acute episode of COVID. And so when we're talking about what are these symptoms, at the top we have fatigue, meaning that you're excessively tired often, right?
Okay.
Next would be persistent cough or shortness of breath. And then also what's called fatigue after exertion, meaning that you can get up and about, but you can't do it for long, and compared to how you used to be able to. And that's caused, frankly, quite an impact on individuals and disability from doing work. And so we know that approximately 1.2 million individuals may be out of work because of long COVID effects and causing them to be disabled. Albeit maybe temporary and in some cases permanently. So, it really is a ripple effect that we're seeing in terms of and what we're learning about long COVID. There's new data to show two alarming things. One, that COVID infections, even if they're mild in regards to not being hospitalized, may increase your risk for type 1 diabetes. And that was published a couple weeks ago in The Lancet. And also, we've seen data pointing towards mild cases even causing vascular, basically blood clots in the brain. And obviously, that's concerning and can cause most likely the phenomenon we hear about, which is that fog brain.
What was it? Fog brain?
Fog brain. Yeah.
Okay.
So we're just learning so much more about what happens after a COVID infection, and it ain't looking good in terms of it being a benign infection. Right, there are significant consequences for individuals, some individuals who fully recover from their acute phase, but then have persistent long COVID thereafter, and that can affect up to 55 million Americans right now, is estimated experiencing
Really?
long COVID.
55. Wow.
Yeah, yeah, almost a third of the population is estimated to that have been infected with COVID is estimated to experience long COVID.
Really, I have a friend who at Kiwanis who had COVID twice. The poor guy didn't really take any shots, didn't get too much into that. And he wasn't into that or masks. And then lately, I think he had some vascular thing around his, you know, skull, and they did some surgery, and then he lost hearing.
Mm.
And I was wondering, for some of these blood clot things, that could be something with that, couldn't it?
Certainly, we know that COVID affects the clotting factors of the blood, and it affects the lining of the vessels of the body, the blood vessels, and that may lead to increased risk for formation of these blood clots. And so we've seen that phenomenon pretty early on in the pandemic, and we continue to see it with these different variants.
Yeah, I'm not sure if that is the case, but it could be the case with this individual. But I just thought about the blood clot thing, and uh, it, that could be that also is on been on organs too, right, and stuff like that, right?
Yeah, that is absolutely correct. We know COVID affects end organs, kidneys, lungs, obviously, liver, and pancreas. And so the pancreas direct effects from COVID infection is part of the hypothesis behind the increased risk from potential increased risk from COVID for type 1 diabetics.
Oh, diabetes too.
Hmm. Hmm.
Well, diabetes gets to the veins too, doesn't it? If I'm not mistaken, somewhat, doesn't it? Diabetes affects your veins too, somewhat.
Yeah, yeah, diabetes, poorly controlled diabetes can affect long term your vasculature and cause systemic inflammatory processes to ensue, which can lead to increased risk for atherosclerosis or hardening of the blood vessels. Yeah.
So that's why diabetes is at risk with COVID. I mean, it's
Well,
they're
it's twofold. Those who are at risk of death and poor outcomes are diabetics, right? Inclusive of
right.
diabetics. In addition to that, a perfectly normal, healthy individual previously can, and I unfortunately know some cases, can contract COVID-19, recover, and then subsequently develop type 1 diabetes as a result of their COVID infection.
Really, that's another.
Hmm.
So that's I guess I don't know. If we want to call that long haul, but it's the same. It's the idea that just getting COVID, it's got ramifications after
Hmm.
your initial bout with COVID.
Absolutely.
Yeah, and maybe I'm going to put you on the spot with this question. No, we're not going to do that. But what's your thought? Are these long haul things going to be declared a disability, or what's the medical? How do you
Yeah.
prove this? Or, I mean, I was a friend wanted to get on SSI, but that stuff you got to have a disability, right? And
Mhm.
so, can you prove a disability on this long haul? Has that been proven so yet, or how is that?
Well, yeah, I mean, in general, disabilities are hard to prove, right? So in general,
Right,
there's
because you
no
don't know how you got a lot of things. Right,
sure,
right,
sure. And so that in general, the approach to disability is not so much an exact science in terms of proof, but more so, is there a more than likely than not probability, right? That this underlying condition, whatever it may be, in this case, obviously long haul COVID, is leading to a person's inability to perform gainful work, right?
right.
And so that we have seen across the board, hands down, we've seen disability as a result of COVID infections and persistent symptomatology. And so, it's one of the reasons that I believe it was the Gartner Institute that looked at, that conducted a survey and reported out that it's estimated about 1.1 million Americans are not in the workforce as a result of long COVID alone. So
How many was that again?
1.1 million.
Okay, wow.
So, again, significant numbers of individuals affected by long COVID, and we need to be more learned about how to understand and help and get people back to the workforce after or with long COVID symptoms in many cases.
I want to ask you this. This is probably very related a little to your work with the business community and businesses about the masks. By not mandating the mask, if it doesn't come from the CDC or something like that, could a could somebody be liable by not watching this mask thing? You know what I mean? By not doing it, you know. On the other side, I think everybody's, oh, yay. I mean, a lot of people, they showed a survey. Most people really want the mask mandates, but there's
Yeah,
a few crowd out there that just go, yay, yay, yay. And so is there a downside to some, with no protocols here, it just sort of it makes a lot of muck for businesses and everybody, doesn't it? It sort of confuses, doesn't it? So your job is to unconfuse it, right?
that's right. That's right. Yeah, and, each opportunity is a consultative one, in that we are trying to be balanced towards protecting the workforce from exposure to COVID unnecessarily, right? And that's the name of the game. Unfortunately, no matter what we say as clinicians and what we advise, and frankly, what companies execute upon, it'll come down to, frankly, OSHA making a determination of, one, is this exposure and outcome a work-related one, and two, was this in the normal course of performing one's work? So that work-relatedness perspective is one that's still in play from an OSHA standpoint, and it's still something that will continue to drive, us towards really trying to be compliant to a degree in the workforce, and trying to really understand how we best mitigate risk for the employees.
Yeah, I know. I think the Biden administration today said they were going to wait for the CDC, and if they say that we should keep these mandates, they'll fight it in court. This judge's
Mm.
ruling, and it's sort of strange that a Florida judge can. Anyway, I don't understand all that, but how a Florida judge can do all this, and then that gets political, and then everybody just sort of says, no, we don't need this or that, and so it's a precarious situation here in the last few days here or more, that if this B BA2. Why don't you give a little ramp up here? Where you think we're going down the road here with the next months here on this
Yeah,
COVID?
so yeah, if we look at and examine the kind of the timeline between look at the seasonality of COVID as we know it today and what we've experienced in the past, we can see not a consistent pattern, but a pattern nonetheless of two spikes per season, right? And early on in the season, it was between week 1 and week 13. And that was 2020, and then 2021 had two spikes, and there was about so the first wave back in 2020 had about 15 weeks in between each spike, and the second wave a little bit longer, and now we're on this, and that was 2021, and now we're looking at 2022. And we're on week three of our seasonality. Currently, we experienced our spike, right? And so now being on week 15, we've yet to see the spike in high numbers, but it doesn't mean we're out of the woods. Again, it was a much longer period of time in between the two spikes for the season of 2021. So we'll need to be and continue to be vigilant with screening individuals, with testing early, and the work, remain at work or return from work policy for dealing with COVID for the foreseeable future.
Yeah, yeah, and you mentioned there's some new variants out there that let's close up here. But how did those countries in Europe come through with this variant? How did they do, Don?
Yeah, tremendous. If you look at Germany, they set a new record for their COVID high. above Omicron BA1, right? BA2 really impacted them from that perspective of positivity rates or cases. But if you look at their, again, case fatality rate, below that of the US. If we look to the UK, similarly, they had a tremendous spike above and beyond where we were, but they've also had again, like I said, almost a 10 times lower case fatality rate. So case wise, they did worse. Outcome wise, in terms of loss of life, they did better than us from a percentage standpoint. So we'll wait and see how the next couple of weeks go. And because we're under reporting so significantly, we may see an uptick in hospitalizations without seeing necessarily a significant uptick in actual cases if they're being underreported to whatever extent. So we'll stay tuned and see what we got here in the next couple of weeks.
Yeah, and you expressed that there is a worry that we are not as good on fighting this as the UK and Germany. Is that what your thoughts were? That you said that the death rates and things like that they were better than we were. Is that what you said?
No, that's absolutely true. And it's not to suggest that they have better care than we do in terms of managing COVID clinically, but it is to suggest that there may be some predisposing factors that make the U.S. disproportionately.
Oh, right. Well, we have healthcare differences by far.
Yeah, that's it. So our burden of disease, chronic disease, illness, particularly around diabetes, obesity, all risk factors for poor outcomes from COVID-19, and therein may lie our both burden as well as opportunity to help prevent.
Yeah, that's another topic about healthcare in America and European healthcare and American healthcare, but there are differences here, and
Indeed.
so that could have a lot of bearing. So again, Doctor, thank you so much for coming by today and sharing some of these things, and you'll be updating us more on long haul too, I know. So we'll keep. And we'll see in the next weeks where we're going here with this COVID new variant and maybe other variants that are coming. So again, thank you so much for taking time and visiting here. And I just want to say on Friday we're working on that guest. We're trying to do Ukraine things too, because we're trying to help out Ukraine in just every way we can, and that's part of my thinking, and I think that's where we should be. So down at the bottom is how to get your shots, and in the western suburbs. So think about that. And till we meet again, and again, I thank Dr. Harris for coming by. And so all I can say now is God bless out there, and bye bye, everybody.